Hi, and welcome. My name is Dr. Daphne Scott, and I'm one of the primary care sports medicine doctors here at the Hospital for Special Surgery. I also serve as a consultant for the UFC. Dr. Marx?
My name is Dr. Robert Marx. I'm an orthopedic surgeon at the Hospital for Special Surgery, and I'm also a consultant with the UFC, like Dr. Scott.
Hi there, my name is Lawrence Epstein. I'm the Chief Operating Officer at the UFC. I'm responsible for all of the global operations of our company.
And hey, what's up, guys? My name is Charles Rosa, UFC Featherweight, fight next week in Jacksonville, Florida. So happy to be here. Also HSS patient.
Great, thank you. I'd like to start our discussion off with Lawrence. We know that there's a plan to make a return to the UFC on May 9th. Why do you feel it's important for the UFC to make this quick return? And what have you guys been doing to prepare for this?
Well, you know, at the UFC, we pride ourselves on being first, and we've been first in so many areas, whether it's our drug testing program, which is truly the first 365-day random out of competition program in all of professional sport. We were one of the first organizations to embrace digital media and the internet. And so, you know, being first back to the world of sport in the COVID-19 era is just a continuation of many firsts that we've had in our history. Obviously, this particular first comes with a lot of challenges and a lot of things that we've never had to deal with before. And of course, health and safety is number one. And so, you know, as we look at being first, we're trying to figure out, you know, protocols, procedures, testings to make sure that what we do when we come back to the world of sport is, of course, safe for all of our athletes and for all of our staff.
Wonderful. And I know you guys have great leadership from the medical side with Dr. Jeff Davidson, who we work with really closely. So that's great to hear.
Yeah, Dr. Davidson's, you know, been an integral part of our team literally for over a decade now. He was an experienced ringside physician, primarily in the boxing business in the early days, but we began working with him early on when UFC began what we call its second chapter, when we purchased the company back in 2001. And as an emergency room physician who sees a lot of trauma-related stuff, as a guy who has been also involved in sort of the combat sports world, and now as someone who's on the front lines of COVID-19, he's just been an invaluable resource for us.
Absolutely. Thank you.
Charles, maybe you could tell us a little bit about training in Florida and how your gym was able to keep yourself and your training partners and other athletes safe during this time.
Yeah, so pretty much I've still been, you know, fortunate enough since I live in Florida to be able to train through the COVID-19 epidemic. The gym is definitely taking huge precautions. I train at the biggest gym, the #1 gym in the world, American Top Team, and owner by Dan Lambert. And the first thing that they did is they closed the gym to the public. So they canceled all their regular classes, all the normal classes that they have that the public are allowed to come to, and they just kept it open only for fighters that had upcoming scheduled bouts and fights coming up. So fortunately for me, I was one of those fighters. So, you know, pretty much I'd say a fourth of the pro team was allowed in the gym. I keep the same 2 training partners every day and the same 2 coaches. So I don't usually I'll have 10 or 15 different training partners in one day, just cycling through different guys. But, you know, I've kept it to the same 2 or 3 training partners. They got some extra cleanup crews coming in, like cleaning the mats, like every session, basically cleaning the sweat up after you. So that definitely helps a lot. And pretty much just securing, you know, there's certain things, keeping out Lysol, keeping out wipes, just taking the extra precautions. So for me, it seems like, you know, it's as safe as it can be. Obviously there's some risk involved, but that's, you know, we're fighters and that's kind of what we're used to. We're risky guys. So.
Charles, in addition to being a UFC fighter, you're also a chef. And I know that you've been posting some of your meals on Twitter. So what's been your go-to or your favorite meal during training?
Yeah, for sure. So my meals now look a little different and a little healthier than they normally do. What I would like, you know, no adding extra butter and stuff. So I'm on a super strict diet. I've been on a super strict diet for the past month, knowing that I had upcoming bouts. So I've been, you know, eating really clean. But my go-to right now, you know, I graduated from Johnson & Wales Culinary School with a degree in culinary arts. So I'm also a chef before I ever started fighting. That was like my first passion. But I think, you know, I was born a fighter, so that's kind of the road I ended up taking, and it's my true passion and my true love is fighting. But my other hobby, my biggest hobby is culinary arts and cooking. So I definitely have the luxury to be able to cook my own meals, especially with restaurants and stuff being closed now. There's no restaurants open besides for takeout, but you know, I'm on a super strict diet. But as far as my favorite go-to meals, you know, I usually get some fresh fish. There's a fish market that's still open, and you know, I've been cooking some really good like scallops. If you check out my last Instagram post, I had a nice little scallop thing. I, you know, taught people how to make it and stuff like that. So I've been having a little bit extra time being inside of the house, being able to play with some other things. But yeah, that's my other passion is culinary arts and cooking. So you can also check that out on my page.
You know, it's so interesting because there is such this incredible crossover between sort of the culinary arts and the martial arts and MMA. I mean, we have so many fans that come from the culinary world, whether they're chefs, whether they're restaurant entrepreneurs. And, you know, for example, Anthony Bourdain was a huge fan, trained in jiu-jitsu. Alex Atala is an incredibly famous chef down in Brazil, is a huge UFC fan. And it's just so interesting to me, you know, this crossover between, you know, the martial arts and the culinary art. It continues to grow every day.
Yeah, I'm actually still waiting to meet Gordon Ramsay. I've been watching his show, Hell's Kitchen, I think it was, and it's really cool. So, you know, I know he's a big UFC fan too.
Huge
so
fan. Yeah, we'll have to make that happen because he's awesome.
Make it happen. I think you're the guy that can make that happen. So let's do it.
Sounds good. I'll do it.
That's awesome. Lawrence, along those same lines, I mean, what has the response been from the fans, knowing that you guys are getting ready to go back? I mean, the fans are thirsty for sports. So what's the reaction you guys have been seeing?
It's been overwhelmingly positive. I mean, obviously, our fans are passionate about the sport. They're passionate about the athletes in the sport. And, of course, they miss it, like all sports fans do. But they're also concerned about health and safety. They want to make sure that when we get back, we're doing it in a safe way. We're not just doing it to be the first. We're doing it in a way that's safe for the athletes. And I think, you know, we're really proud of the plan that we've put together to reintroduce, you know, the UFC in the COVID-19 era. We put together a 20-page sort of blueprint on how we're going to conduct our events. And of course, the first event that we're doing is going to be down in Jacksonville, Florida. And so our fans are incredibly excited. They can't wait to see UFC, and we're excited that we're going to be doing a series of events, not just one event. We've got an event May 9th, an event May 13th, and then an event May 16th, all coming from Jacksonville, Florida.
And along those lines, I know it's a fluid situation and we're making decisions as things go. Can you share anything more about the future of what the UFC has planned in this time?
Well, you know, as long as, you know, sort of COVID-19 is lurking out there, the world of putting on any events has truly changed. I mean, we're lucky in the sense that we've always put a premium on health and safety for our athletes and for our events. We operate a Performance Institute, which of course HSS is a part of that Performance Institute, which, you know, has high quality health and safety and cleanliness as all part of the game plan that we've got there. So, you know, obviously COVID-19 is new, but the processes and the procedures that we have in place to prevent infections and a variety of things are applicable to, you know, what we're trying to do here. You know, but that being said, you know, what we're looking for in the future, of course, is to continue to put on safe events. And the great thing that's happening is that, you know, literally every day, technology and, of course, the great work that doctors like you guys are doing around the world is providing more information, is providing better processes and procedures, and, of course, better testing and more testing. And that's really from day one. I mean, we felt like we had protocols and procedures in place to screen and do all the stuff that we needed to do. The missing piece of the puzzle was, of course, testing. And initially, there just weren't a lot of tests. Now there's more capacity, and we're proud to say that we're doing a lot of testing around the events in Jacksonville. And then as time goes by, I mean, we're going to continue to grow that capacity. So, you know, that's really what we're focusing on right now, is building this robust testing program that we can make sure all of our athletes and all of our staff go through.
Great. I know that that's what a lot of the leagues are struggling with, is how do you provide that testing to all the athletes and everyone else? So it's wonderful to know that you guys are doing that. And of course, we know that, yeah, safe and healthiness of your athletes is at the forefront of everything. Charles, I'll ask you a similar question. How has the response been to the athletes who are seeing that you guys are getting ready to fight? Are people ready to get back in there? What have you been hearing?
Yeah, definitely. I'm real excited to get back to work and doing what I love. I think a lot of people have mixed feelings, but for me, I've gotten a lot of positive feedback from fans and people reaching out to me saying like, this is something that we really need. Like, it's, we need to get back to normal life. Some people have lost their jobs, people have lost things. So this kind of gives some people some inspiration and hope for the future. And this is kind of maybe the start of coming out of this thing, that it's kind of like a stepping stone to the next level. So, I'm really happy to be part of history and to be part of some coming back to this. And, I'm excited for next weekend.
Definitely. Well, we're excited to watch.
How about any new locations for fights? I'm sure fight fans are excited about the thought of having these fight cards and shows in different places. Any idea when that may occur? And certainly when fans may be allowed in, although that's probably a ways off.
Yeah, no visibility right now on fans, but as far as locations go, it's very much dependent in the United States on regulatory, oversight by state athletic commissions. So the reason why we're going to Florida is because the Florida Athletic Commission is up and running. They're going to supervise and regulate the event and provide oversight of the event itself. And, the UFC has always been sort of regulation first. I mean, we're the guys that went around the country and got the sport legalized and regulated in the United States and frankly around the world. And so we're a company of regulators. We respect regulations. We feel it's key to our success and our athletes' success. And so that's the beginning point, is having a regulatory framework and a regulator in place. And that's why we're going to Florida. We're really hopeful, in relatively short order, the Nevada State Athletic Commission will be up and running and we'll be able to do events here in Las Vegas. We have a really unique situation in Las Vegas in the sense we have a facility directly across the street from UFC headquarters called the UFC Apex, which we own and operate. That facility is a closed facility, but it has full production capabilities in it. It's got a full Octagon setup, and it's got a gym and a variety of other facilities that we need to put on these events, all in a closed and controlled environment. So whereas in Jacksonville, we're using an arena, in Jacksonville, of course, it's closed. There'll be no fans there. We're very excited about doing some events in Las Vegas at the Apex facility. And then, as states begin to open up and they begin to reactivate their athletic commissions, you'll see us, travel around. There's several other states that are in that process right now. But, a lot of it, also is going to depend on when fans can actually come to these events, because it doesn't make a huge amount of sense just to go do events in other cities outside of Las Vegas where we have this closed facility if we can't have fans there. So, we're really hopeful that fans are going to get back in the arenas, relatively soon. But obviously, as I hear a lot of people say, the virus gets to make those decisions.
Very true. Well, do you guys have any questions for either Dr. Marx or myself?
I do. First of all, I've got tremendous respect for what you guys have done. And I've had the great opportunity to visit the HSS facility in New York City. And I just wonder, obviously non-essential surgeries are shut down. At least they have been for a while. I mean, what are you doing with that beautiful facility in New York City?
Yeah, I can start, and then Dr. Marx, if you want to jump
sure.
in. New York City, as everyone knows, was hit very hard, and being an orthopedic hospital, leadership, rightfully so, said we just can't sit by and let our neighbors take the brunt of this. So we actually went down to about 10% of what our normal operating capacity could be for emergent care only. And then we transformed ORs into ICU rooms. We transformed floors into rooms that could take care of COVID patients. And all of us who normally are taking care of shoulders, hips, knees, and things like that kind of went to work in the hospital. My primary training is in family medicine. So I put my family medicine hat back on and started doing shifts 3 days on, 3 days off, taking care of COVID patients, mainly who were on supplemental oxygen, but essentially trying to get them off of oxygen and get them home. So definitely a big change from what I typically do and what I know my colleagues typically do, but can't have imagined spending that time doing anything else.
And now that we're a little past the peak, we're in the process of going back towards a new normal at the hospital, and we'll be increasing our orthopedic work very gradually, very carefully, in a very different and new way than we have before. But we're starting to think about going back in a very slow way towards caring for urgent orthopedic problems.
Yeah, one thing I just want to say, I mean, I'm forever grateful, for HSS for giving back my professional career, because I'm not sure I'd even be able to be fighting this weekend if it wasn't for you guys. And then even more so, I'm very grateful and much respect towards what you guys are doing to get people's, lives back in order, and what you guys are doing, on the front line. So I just wanted to give you my hats off and respect to you guys.
Thanks. And Charles, good luck in the Octagon.
Thank you.
Best of luck. So I think that's all the time we have for today. Thank you again for joining us. We want to thank Charles and Lawrence for joining us. And you can always visit or leave a comment below or at hss.edu. Thank you.
Thank you.
Thanks, guys.
Thanks, everyone.